Hello, welcome to the End of Life Lounge. It is a great honor today to welcome Dawn Brinkley to join me, and she'll be here in just a minute. Dawn is a palliative care nurse in Southern California, and she is very experienced in what it means to have the advance directive in place and what happens when you don't. So she's going to share with us some stories about families that she's worked with. So let's welcome Dawn in. There we go. Welcome, Dawn. How are you today?
Thank you.
How's your day going so far?
My morning is going great. It's a beautiful rainy day here in Southern California. It's early, so we do like the rain here because we're always in a drought.
Yes, that's so nice to have that moistness in the air. We don't have a problem with that in the Pacific Northwest. But
yes. Yeah, you do not have that problem.
No. Yeah. So I'm so excited to welcome you here. I know we have had questions in the group about what it means when people have the documentation in place and what happens when they don't. So why don't you share with us a little bit about what palliative care is, and then go ahead and share some stories.
Wonderful. So I've been a registered nurse for about 36 years. The last about 10 of it in palliative care, primarily in hospice for 20 of that, and then home care. So I've been doing community health for my career. And so because I work with patients that have life-limiting illnesses, having those documents in place, a POLST, is what we have here in California, in Southern California. I think the POLST is available everywhere, but you have to check your state. Mm-hmm. And those advanced directives, it's a broad term for different forms. But basically what we always want to know and what you should always put in place when you're healthy, because you don't want to think about this when you're sick. It's just, you're thinking about other things, is how you want the end of your life to go. If your heart or lungs were to stop, what do you want done? And no decision is a bad decision. It's just that it's important that the medical community knows what it's done and that it's logged in and that it goes with you if something happens to you. But most importantly, it's important that your family knows what you want. I know for me, being a cancer survivor myself, it was important, and I should have known. I didn't have these documents in place before I got cancer, and so then I rushed and had it done. And because look, here's the bottom line. Like for me personally, I don't want to be intubated. I don't want to be on tubes. I don't want to be a vegetable. I don't want to get to the point where the family has to put me in a skilled nursing facility, or someone has to change their life around to accommodate mom being at home in a bed and having to turn me every 2 hours. That is not quality of life. Now that's for me. Right. Everybody has to decide what they want, right? Mm-hmm. So on my advance directive, or basically the living will, was kind of interchangeable. Yeah. I put that I don't want any tubes. I don't want to be intubated. If my heart or lungs were to stop, just let it go. I don't mind having IVs. I don't mind having IV antibiotics, that sort of thing. You can specify. But if a doctor or two doctors say to my family, look, she's brain dead, I don't see it's 10% that she's going to come back out of this. And if she does, she's going to be a vegetable. Then I need you to be able to know that it is okay with mom that you pull the plug. Right. Wow. And so when you're making that decision while you're healthy, it is a much easier decision. I think a lot of people, because what people would say to me, the families that I come in contact with, they'll say, well, I don't want to think about that right now. And a lot of them think that it's going to get them sick thinking about it, that they're going to go. So they'd rather put it off. The problem with that is that when you get into a situation, and I'll tell you two stories, where those documents are not in place, it puts your family in a horrible position. I have seen families torn apart. So let me tell you, that we had one case. One of our families had 11 adult children. Oh my gosh. The dad was incapacitated, but meaning that he was no longer, he had a disease process in which he was no longer able to make decisions for himself. Let's say he had dementia or Parkinson's, one of the neurological problems. So the wife had passed away. There was no wife. So it was just the 11 adult children. I had to sit down. I was the case manager that went in. So I'm sitting there, dad's not able to make decisions for himself. And I'm sitting around with all 11 of them. And I said, who is the power of attorney? Who is the appointed person that's able to make decisions for dad? They all looked at me and I looked at them. No one had any idea. I said, oh my God. I said, have you ever, and I said that in my head. I didn't say that because I had to remain calm because they were losing it. I said, did you discuss with your father what he wanted done in the event that he got into this position? Half the kids said, dad wants everything done. If something happens, he's going to the hospital. We want everything done. The other half said, dad doesn't want to live like this. What are you talking about? This is not how. It literally was an hour of yelling back and forth. So let me tell you how that family, even till this day, because I kept up with one of the daughters, even till this day, dad has in fact passed away. But even till this day, the family is still decisive.
Yeah.
Because it divided them. Whereas they were quite a loving family before that. They didn't have this problem. That was heartbreaking. They didn't have that problem with mom because dad made the decision for mom.
Okay, so they had talked about it, but
they had talked about it, but nobody talked about it to the kids.
So I have a question about that. With that many kids, is there a legal, like the oldest child or the most involved child or anything like that?
Somebody usually steps up. So somebody will look at one of them who's usually the most responsible of the siblings. There's always one that's the most responsible. That's always been there, been there for mom. So they'll kind of lean towards that person. That is the person that medically we will listen to and take direction from. But it literally is, you want to make it very, very clear. Don't just say, oh, my kids know what I want. No, they don't. No, they don't. You might have had a conversation with them 5 years ago. They don't. Write it down. Write it down and put it away, right? I have mine done. So I don't have to look at it every day. I just have all of this, the advance directive, all the information, everything down. And I've told them exactly where they can find it.
That's important.
So if something happens, right? They have a key to the apartment. Something happens, they can go in, they go in the closet, they get this and everything's written down. They don't have to look at it right now.
Yeah.
Right. So that was one of them. Another situation, another one had happened the same way. They were, the kids, it was only 2 or 3 of them. They were in agreement, but it was an uncomfortable decision because mom never told them what she wanted. So now mom's in the hospital. They intubated her because they didn't know what else to do. There was nobody to make a decision.
Yeah.
So a lot of times if you're 911 into the hospital, before the family gets there, the doctors have to make a decision.
Yeah. So what does intubation actually entail? I get that question a lot because it's right there on the advanced directive form, right?
That is a breathing tube that goes through your mouth down into your lungs. And it is a mechanical breathing. You're not able to breathe on your own. So it's what you see in the movies where the person, it's much more complicated than that, but it's a mechanical breathing to get to breathe for you.
And why don't you want that?
Now here's the thing, the family already knows. If I'm in a car accident or something like that, where something goes down of that nature, yes, I want everything done. Go ahead and that. But if I'm going through a disease process, and it gets to the point where I'm not able to breathe on my own, or I pass out, or my heart or lung stop. I think it's the heart or lung stopping in a normal disease process. Then I don't want to be intubated because me coming out of that is slim. Different than if I'm in an accident, I have a heart attack, something like that. So it's different scenarios.
The great thing is that we can specify those different scenarios in our advanced directive.
You can.
So it's not like you're signing away your right to have any kind of care. And
No.
it's advanced directives are not just for the end of life; they're for any time we
That's
lose capacity. And so it's such a
correct.
gift.
And that decision can be revoked at any time. So you can, even if you put down, no, I don't want that done. But how about if I'm kind of alert or my family says, okay, this is a situation where mom would have wanted us to do that. Then you can revoke that at any time. The power of attorney.
Yeah. Yeah. So how about a family where there was some document in place?
Oh, the wonderful. So that's the goal when we're out there, is I get the social worker involved immediately so we can get those documents in place. But it's a beautiful conversation to actually to tell you the truth. So the family sit around. Sometimes it's emotional because, like I said, my particular caseload is end stage. But they're able to sit around and they look at the pink form and they're able to say they want artificial nutrition. And sometimes the adult children are like, oh, really, mom, you want it? You want that? And sometimes the mom goes, yes, it's a bit of a shock, what she wants, what she doesn't. But it's beautiful because and it literally takes a couple of minutes. It's not to say, check, do not resuscitate, but I do want IVs and I want antibiotics and I want you to do some preliminary things. And no, I don't want a gastric tube. I don't want artificial feeding. This I want. And you're just checking the boxes. You can change it any other time. But what's really nice, now they've got the form. It goes on the refrigerator. And so that when paramedics come, they're able to see it. It gets scanned into your insurance company in the hospital of your choice. Then you have a copy that goes with you. So whenever no one has to be called, a copy can go with you. And it gives everybody, the medical community and the family, direction. Now no one's arguing. They're like, no, mom says she wants this. No, you can't put that tube in. So if the doctor calls and says, you know what, she's not swallowing effectively, we want to put a gastric tube in. The feeding, the family, now we have this one family where the kids were like, nope, mom clearly said she didn't want any feeding tubes. Can you imagine? And this has happened, waking up when you said, we had a patient like that. He was resuscitated, he was intubated, and when he woke up, he was 90 years old. He was beside himself that he was alive. He was ready to go. Yeah. And his family brought him back. Oh
gosh. For what? For what kind of quality of life? It wouldn't make any sense for them.
It was terrible. Then he suffered for about another year or two. And then he finally passed away. It was just awful.
Yeah. Yeah. So that the form we're talking about here is the POLST, or Physician's Orders for Life-Sustaining Treatment.
Correct.
And that is separate from the advanced directive.
Correct.
You don't fill out the POLST, at least in Washington State, until you have a terminal diagnosis. You don't have to be on hospice. But
you can fill out the POLST here in California anytime.
Anytime. Okay.
Yeah,
so that's the difference. Yeah.
Yeah, we want that POLST just in case.
Okay. Maybe it's changing that, because it's wonderful to have that just very simple document for the medics to see when they come. And I'll be interviewing a paramedic, EMT, firefighter tomorrow, and he'll be talking about what happens also when they do and don't have that in place. So what do you think about having both the longer form, the advanced directive, and a POLST?
I think both are. The POLST is very clear. The POLST is literally for medical. It is literally making a decision of the physician's orders for life-sustaining, about life-sustaining measures. And advanced directive covers a gamut. It covers that, but it also covers who's going to make the decision in the event that you can't.
Yeah.
Right. And so it's just good to have all of that information. Right.
Yeah. I don't think a POLST includes a healthcare power of attorney. They might have contact, but
the decision maker information is on there, but you want to have it in actual writing. The POLST does not have to be signed by a notary or witnessed. It is just signed by the physician.
Okay, great. And speaking of power of attorney, who is a good power of attorney? Who makes a good power of attorney? What qualities would they have? Should it be your partner or a child, or, what's your experience with that?
Yeah, it can be, you want it to be, let me tell you who you want your power of attorney to be, because I grappled over this because I said I didn't want to put my kids in that position, and I grappled over it. So my power of attorney is actually my ex-husband.
Oh, yeah.
And the reason why we still have a great relationship, right? But I also know that when it comes time for, if something happens, that I know that he would be able to emotionally disconnect and do what is right. And that's what a good power of attorney is, that you've explained what you want done. They get it. They're emotionally able, they can divide up their emotion from your needs. It's important that you pick someone that is really going to horn in on your needs. Now that could be the spouse, that can be one child. I have a lot of people, it's their adult children. They'll have the first alternate, they have the first person, then the alternate, and then the second, right? But you always want to make sure it's going to be someone that's going to carry out your decision. You don't want to give it to an adult child that is emotional. Every time you talk to her about it, she starts bawling. She is not going to be the one that's going to make the decision at the time. It's got to be that very pragmatic person in your life. It's like, I got it. I'll take care of it.
That's so important. Yeah, they have to be able to talk with the doctors to understand the medical terminology, and have that sort of sense of not distance, but just respect for what you want.
That's it, Joanna. Respecting your wishes.
Yeah. Oh, wow. Well, this has been just so wonderful to hear your firsthand experience with this, and I appreciate your time so much. I know that you have another service that you provide. Could you talk about that just for a minute or two?
Oh, okay. I am also, not only am I a registered nurse, but I am a Legal Shield agent. And one of the big things we do is that we give you your will. I think it's probably what spoke to me about getting into Legal Shield, because I am in the nursing field, is that we give you your will, your living will, your power of attorney for healthcare, and your power of attorney for finances. Not only are you able to get 4 of those estate planning documents completed with our company, we have law firms in every single state in all 10 provinces of Canada, but your spouse gets it as well. And it's only $359. So there you go. That's all.
Huge benefit. Yeah.
That's a huge benefit for both parties to get it for that one price. Okay.
Wonderful. Well, thank you so much. And anybody who has questions for Dawn, please put them in the comments, and she will be monitoring that. And thank you again so much. Really appreciate it.
It's been my pleasure
today. All right.
You guys have a wonderful day.
All right. You too.